So when it comes to replacing teeth, especially from partially edentulous arches, it's always a very important question which we address, whether to retain the other teeth, the remaining teeth, or should we go for a full extraction and a full arch reconstruction. So this is a very important question which always needs to be addressed when we look for a partial, when a patient walks in for a partial teeth replacement. So in this particular video, we'll do a video series. Let's see what goes into the diagnosis of this. How do we diagnose it? How do we treatment plan, and how do we eventually get the full arch reconstruction done in the video series that we are planning to do. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai Rajanamalipuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So now come, let's look at one particular scenario where I will explain the process that goes into the treatment plan, diagnosis and treatment planning. For example, so this particular patient had a missing teeth in the right upper region. So he had a lot of teeth missing here. He had his lower teeth, of course, but for one teeth that was missing, and most of his upper teeth in the front as well as in the left side were there. So he came actually asking for a replacement of this particular set of teeth only. So when you look at the X-ray, then we see what is the condition of the remaining teeth. So when you look at the condition of the remaining teeth, so it's both a clinical call as well as a radiographic call. So when I say a clinical call, we'll say how healthy the teeth are, how healthy the gums are, whether there are any gum recession that is there, whether there is any gum inflammation, or there are gaps between the gum and the teeth which we typically call as pockets. Is there any gum bleeding? All those are the clinical things that we take into consideration. Of course, we check for the tooth mobility also. Are the tooth mobile? And if they are mobile, what is the grade of mobility? And what needs to be done to improve the condition and health of the teeth? So these are something that we look at clinically. So when it comes to X-ray, so we always look at the amount of bone that supports the teeth. So in this particular patient, if you look at it, I'm just going to draw the bone for this particular patient. And if you look at it, as I draw this, so this is where the patient existing bone structure is. And if you look at it, there is so much of bone loss. Ideally, this bone has to be somewhere here. And if you look at all these areas, it's less than 20% of the tooth structure that is actually there inside the bone. So now if we leave this and then plan an implant replacement or a partial denture reconstruction of only his upper right side, that was his presenting complaint, then what typically happens is, as we do the treatment planning, then the front teeth will necessitate extractions at different point of time. So then it will not be a comprehensive plan, or the infection from the front teeth can affect the implant that is placed on the posterior teeth region. That can also happen. Alternatively, when the front teeth loses more bone, we might have less bone to actually plan an implant reconstruction for the front teeth. So for this particular patient, what was advised is extraction of all the upper teeth and then an implant replacement, a full upper arch implant replacement was what that was planned. So when it comes to lower teeth, of course, there is a lot of bone loss in the lower segment also, as I'm showing you. But when it comes to the lower arch, the important call that we take is whether the lower teeth, if you're going to do some gum treatment, can we retain these lower teeth for the next 5 years? So if you can retain the lower teeth for the next 5 years, then it will be a wise option to retain the lower teeth and only do an upper arch, full upper arch reconstruction. So that was what was actually planned for the patient. In the coming video, we'll see how we can do the planning and how we can actually go about doing it. Hope you like this video. If you have any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.